so much. So it is a pleasure to be invited today to speak about the work CDC does to support healthy sleep. It's one of the most, it's one of our top 5 important or most essential health protective behaviors. And as a result of our work within the National Center for Chronic Disease Prevention and Health Promotion, the work around sleep at CDC resides within that center. We know and recognize and have worked in the sleep area, both from an applied research perspective, but also from a programmatic and public health view for how we as an agency can address and promote healthy sleep, adequate sleep with the right amount of time. And we also know the detrimental impact that chronic sleep deprivation can have on one's health, particularly as it relates to chronic disease risk factors and or conditions, which is why it sits within our center. There are lots of places at CDC that might touch the sleep area, but for us, this is a primary focus. And as I said, one of our most important areas for advancing our, what we understand and how we can help support the health and well-being of the populations we serve. At the National Center, our mission is to help people and communities prevent chronic diseases and to promote health and wellness for all. You can see the nice visual here. What makes this really unique, oh, can you see that okay still? Yes, I hope, okay. Sorry about that. I don't know why it keeps doing this. This is very frustrating. Okay, can we still see that? Yes, all right. Our mission is to, as I said, is to really focus on people and communities to prevent chronic diseases and promote health. I'm gonna have to turn this off. It's not, hang on just a second. This is not, I can't see anything now. Really having technical difficulties. Are you seeing, can someone tell me if they can see my slides?
Yeah, that will work. It's a little bit smaller, but it will work if that's.
Okay, this might actually help. If you don't mind, can you see the next slide now?
Yep.
Okay, good. I apologize. This is frustrating for everybody. I mean, I only have a few minutes. So back to the National Center. So we do recognize this is a very important area for us, along with the work that we do in our center to address, for example, we call it, I think, our top 5 important protective behaviors. We include adequate sleep, along with the excessive, refraining from tobacco smoke, forgive me, and excessive alcohol use, as well as making sure that you are getting your preventive services and as part of your routine. So I think those are the things that really do, like when we look at those collectively, those 5, those really are the critical for ensuring the mental and physical health and well-being of the populations we serve. And we also know, as I said, that by limiting our sleep, especially when it is chronic, this absolutely has deleterious effects on increased risk for diabetes, obesity, heart disease, and stroke, even cancer. So we are learning so much now about the role that sleep plays in enhancing and supporting our health, and also the role that sleep, lack of sleep can play on the harmful role it can play on our health. I represent the Division of Population Health. I'm the division director within CDC of this division. The division is unlike some of the other divisions in our center, where they focus specifically on a health outcome like tobacco, or that's behavior, or heart disease and stroke, or reproductive health. We are focused on a range of public health topics that are very cross-cutting, such as sleep. And we focus in 3 areas. We do so by 1, providing state-based and local data on chronic disease risk factors and conditions. So we are the keepers of the behavioral risk factor surveillance system, which is a critical system. We've had a history of working with many partners on the work around sleep and making sure that we have data modules available in the BRFSS so that we can get data to report on what the population prevalence is for sleep, and also who in that population, or the percentage that is not receiving adequate sleep. We also focus on population-based strategies to address specific health outcomes within groups or settings. In this work, we really do organize the portfolio by age groups. So we have a healthy schools program that looks at K through 12, and adolescents obviously is included in that. We also have a worksite health program that looks at middle age and young adults. And we have an older adult program that focuses on aging. And sleep is integrated into all of those because we recognize this is very important across the lifespan. And as we age and change, our sleep needs will change as well. But the importance of getting that 7 hours sleep is critical. And finally, we do a lot of innovative data analytics and prevention research, and I'll get to some of that in a moment. I'd like to begin by just throwing out what we've done in the past around our work to promote healthy sleep. We were very fortunate about 5 years ago, about several years back, I think we had a cooperative agreement or award recipient with the American Academy of Sleep Medicine. And the focus was on part of the National Health Sleep Awareness Project. And there were a number of accomplishments. It's a very busy slide that came out of this work several years ago. And it was prior to my time here, but I think it's worth mentioning the work of the partnership between CDC and the American Academy of Sleep Medicine. So the two that come to mind right away are the sleep duration recommendations of adults and children, particularly getting 7 hours sleep. And that has really changed practice in the field in terms of start times for when schools do start. And children and adolescents need to show up for school. We also have had multiple public awareness campaigns. We developed, as I mentioned briefly, the sleep health surveillance questions in the behavioral risk factor surveillance system. And I think if I'm looking at my notes here, the education, we also have had, an opportunity to educate some of our healthcare providers around the importance of sleep and using that information in meeting their patients and talking with them about the risk behaviors that they might be engaging in general. All right, next slide. This is a deeper dive on the past CDC activities that we've worked on sleep, but particularly focusing on the data collection side. So as I mentioned, VRFSS has been fortunate that we developed a sleep module. Back in 2017, we were able to use that module. It was we funded it through 8 states and Washington, DC. The questions they're not many in the module, but they do talk about sleep duration and symptoms. So things like falling asleep and difficulties falling asleep or staying asleep or sleeping too much, unintentionally falling asleep, ever being told that they snored loudly, and ever observed that they've stopped breathing during sleep, which is a really important risk factor for poor health. Those modules that module is always available to our states. It's being offered every other year, though, not every year. So it is available, but it's an optional module, meaning states may opt to choose this as part of their data collection for that year or not. A lot of it has to do with funding and the lack of funding that we have at the moment around no real concrete sleep line item from Congress. Without that, it makes it difficult to really foster and or encourage data collection or incentivize it with our partners. But this has been a wonderful example of what the work has occurred, working in partnership with partners like the National Health Sleep Awareness Project and others and around how do we advance an understanding about sleep, in particular through our data collection, and then how do we translate that into public health practice and or action through interventions, communication campaigns, or through actual changes in public health practice, changes in policies at the state and local level, especially in the case of education. All right, as I move into, moving forward, the current activities are really exciting, and I'm happy to report that we have been successful in this year in receiving some funding through what we are calling the National Approach to Chronic Disease Education and Awareness. It is a grant. It's not a lot of money, but it's the first time we have a very flexible grant, and we had a notice of funding opportunity. This is a 3-year grant that begins this month in 21. that we will be supporting. And it was intended initially, the purpose of the grant was really to help identify some of those cross-cutting topics that aren't currently receiving CDC funding, but are very important to the field of public health and as a public health issue. It just hasn't been giving the attention it receives. And obviously, if it's not a program that is directly funded, and though we do need that money to grow the program, this is one way to get us a little bit further. So as a result, we have had and identified several different topic areas, one of which is that we have is focused on sleep. And we were fortunate that the American Academy of Sleep Medicine is one of the new grantees that will be now using a portion of those dollars to move forward on the work we've done on sleep and advance it to the next level. So here are some of the strategies that we had outlined in that grant. And again, it's a grant, so it gives a lot of flexibility to the partner that we fund, but data dissemination activities that support awareness for public health professionals, continuing that education piece, data collection tools, as I mentioned, for BRFSS, educational activities supporting public health awareness, and then educational activities supporting health professional screening, referral, and treatment management, all important to the world, to advancing our work on sleep and to improving the sleep of the country. So the next slide just shows where we're going to be at least collecting more of these data through the BRFSS. As I mentioned, I didn't mention this, but there is a core question on the number of hours of sleep that's included in the BRFSS every year as part of that core. Those data are then reported publicly and then included in our places, which I'm going to speak to in just a minute, which is we use that data to create small area estimates. So you can look at neighborhoods, districts, you can go at any level of geography and assess the sleep measure. It's a prevalence estimate of sleep in a very local, granular way. And you can do so in combination with other data that we have at that level of geography on chronic diseases. So it's going to be very useful for anyone working in this area. CDC does not have the resources currently to support inclusion of the module that we've talked about every year. So what we would like to see, though, is that states can, and we want to encourage states to use the module and collect those data if they can. All right, so I started mentioning places, but there's so many other places we are, ways in which we get the data out. So that one question that I mentioned that is collected in the core BRFSS is used reported in our chronic disease indicators website and data portal. We also have it in places, and you can go within places on the right side. You can see there's geospatial mapping that is really important for helping you identify patterns of these behaviors or risk factors and target resources where they are needed most to meet those disenfranchised or marginal or at-risk, high-risk groups. So this is all very exciting for us because we're seeing the use of new technology and visualization tools and analytic tools to help support data analysis. We also have several different research activities that are ongoing. We just recently published a new report from last month on the first ever estimates of children who do not meet the AASM age-specific sleep duration recommendations. And that was I don't know if folks are aware, it was an MMWR, it's listed here. It's based on again, 2016 to 2018 data because we don't have current data, but that just shows what we can do with these data. There's also been some other MMWRs on sleep. So there was a sleep duration and quality among US adults with epilepsy that was back earlier in September, and then short sleep duration by disability status and functional disability last year, July 2020. So all of this to say the data are really important for getting these messages out and to share the important role that sleep plays in promoting health, or where we're having concerns or areas of concern where we need to have more public health investment in action to improve the health and well-being of the population. We currently also have because of the emerging evidence on sleep, and it just continues this evidence of what it does to support health, mental and physical health. We are now going to be issuing a special issue for preventing chronic diseases that's focusing specifically on sleep. So Preventing Chronic Diseases is a well-read journal that we oversee in our center, that CDC oversees, and they are interested particularly in looking at publications on sleep from across the world, bringing attention to the relationship between sleep and chronic disease, and offer insights into how public health strategies can help improve the quality of our sleep. So it's a really exciting time for us. We're looking forward to the new partnerships, to these new publications, and I appreciate the opportunity to speak with you today. I apologize for the clunky start to this presentation. Thank you.
Thank you so much, Dr. Thomas. There's lots of stuff there. So lots of really exciting different approaches. I'm especially excited to see this new announcement for the journal.